Former President Donald Trump didn't deliver on his 2016 campaign promise to build a new wall covering the entirety of the US-Mexico border. But his administration did succeed in doubling the height of some of the existing portions of the border wall. And though there's little evidence that the higher wall actually slowed illegal border crossings, it has caused a big spike in serious injuries to people who've fallen off the 30-foot wall. UCSD Health received 270 border fall patients last year, 200 more than it did in 2019 when the wall was at a lower height. The hospital is already on pace to get more than 300 this year. Dr. Jay Doucette is head of UCSD's trauma unit. He says they're getting so many patients from Customs and Border Protection, or CBP, that the hospital now has a special section just for them.
We had to open up another ward just to deal with the surge from the border.
Many of these patients require lengthy stays in the ICU and multiple surgeries to repair broken bones. In addition to the increased pain and suffering of the victims, this new reality is putting pressure on hospital resources.
As length of stay goes up and the more surgeries that are required, the more expensive things are as well.
But who's responsible for picking up the bill? Well, that's where things get a little murky. CBP is responsible for the medical expenses if the patient is in their custody when they're discharged from the hospital. And that was usually the case as recently as 2019 and 2020. Data from UCSD shows that CBP paid for roughly 75% of the patients their agents brought into the hospital in 2019 and 80% of patients in 2020. But staff at the trauma unit saw a shift in 2021.
Well, now we notice that they're not sticking around as much.
Doucette is referring to the CBP agents. Beginning in 2021, CBP began keeping far fewer patients in custody. Instead, the agents were increasingly giving them a notice to appear in immigration court and walking away. This change in approach coincided with a new California law that expanded health benefits under the state's taxpayer-funded Medi-Cal program to undocumented immigrants. Doucette says that by releasing patients from custody, CBP is essentially handing their hospital bills over to California, which pays for them with a mix of state and federal funds. CBP's own data backs this up. In the San Diego sector, the federal agency covered the medical expenses of roughly 3,000 patients in the fiscal year 2019-2020. That number dropped to 1,300 in 2020-2021, and only 550 during the first 10 months of the current fiscal year. Meanwhile, the average cost per patient has quadrupled, from $1,500 in fiscal year 2019-2020 to $5,500 in fiscal year 2020-2021. CBP officials would not comment specifically on the reason behind their new approach. Instead, they issued a statement confirming that patients who are not kept in custody receive a notice to appear in immigration court. Meanwhile, the practice is drawing criticism from both sides of the immigration debate. Hans von Spakovsky is a senior fellow at the Heritage Foundation, a conservative think tank. He's an outspoken critic of CBP's so-called catch-and-release policy, where Border Patrol agents apprehend migrants who cross the border illegally and then let them go with little more than a notice to appear in court.
So in essence, they are saying, we're going to release you into the country and we're just not going to worry about you anymore.
Von Spakovsky says that there's a significant risk that migrants will simply not show up to their immigration court hearings and continue to live in the country with no legal status.
It makes sense if you think about it, because if they're in the country illegally, what's the point in going to court where you might be detained and actually deported from the country?
Pedro Rios is an immigrant rights activist with American Friends Service Committee. He says the taller wall was built specifically to injure people and deter others from crossing illegally. The fact that CBP is not paying for many of the patients is a sign that the federal government is not taking responsibility for the consequences of extending the border wall.
In fact, they're leaving the rest of San Diego County, the rest of California, to pay for the injuries that are caused as a result of poorly thought through enforcement plans such as the border wall that is causing these injuries.
Von Spakovsky views this as a much larger trend in which local communities end up paying for the federal government's border policies.
There are numerous studies that have been done on the costs of this kind of illegal immigration. And all of those studies show that the vast majority of these costs are paid by local governments, not the federal government. And healthcare costs are one of the big factors.
He blames this on what he considers the Biden administration's lax enforcement policies. Gustavo Solis, KPBS News.